Welcome back. Lung cancer is the second leading cause of death in this country, but a recent major announcement is projected to save up to 70,000 lives per year. Joining us from Gundersen Health System this morning to discuss low-dose CT scan screenings is Dr. Scott Skibo. Thanks so much for joining us.
Thank you for having me.
And so first of all, let's talk a little bit about these screenings and how they are helping detection and how do they do so?
Well, the major problem with lung cancer is it's often diagnosed at an advanced stage. So the whole purpose of lung cancer screening is to try to detect lung cancer at an early stage. If detected at stage 1 and immediately resected, we have a 90%, greater than 90% 10-year survival. As we're currently diagnosing it, we have up to, only a 15% 5-year survival if diagnosed at stage 3 and 4.
Okay, and so what are your recommendations for what age should you start to be screened?
So the U.S. Preventative Task Force has released a draft statement July 30th recommending patients aged 55 to 80 be screened with a yearly low-dose CT scan.
And a lot of the times with this, is it also covered by your insurance for this type of screening?
Well, currently right now that's variable, and it depends by insurer. With the announcement by the U.S. Preventative Task Force, I suspect that there will be more robust coverage by insurance, including Medicare, in the future.
And with this screening, I'm sure from your standpoint, are you really happy with the results, seeing that they're projecting it could save up to 70,000 lives per year?
Well, absolutely. For the longest time, we've been waiting for improvements in lung cancer mortality. And certainly improvements have been made in chemotherapy, radiation therapy, and surgical techniques. Nonetheless, our outcomes remain dismal, and more people die from lung cancer than breast cancer, pancreatic cancer, colon cancer, and prostate cancer combined. So this is an opportunity to really move the needle and improve mortality by 20% is what is expected, which is a significant improvement over where we currently are at.
And along with screenings, what else do you recommend that people can do in their everyday life to reduce the chance of lung cancer?
Well, the biggest thing clearly is smoking cessation. 87% of lung cancer deaths are related to smoking-related, to smoking use. And so smoking cessation is clearly #1 as far as reducing the risk of lung cancer death. Okay.
And even the chance of secondhand smoke as well?
That is a bigger contributor than people realize, and certainly I, as a pulmonologist, fully in favor of the workplace limitations place with smoking. I think that secondhand smoke is a much bigger contributor to not only lung cancer but COPD than people realize.
All right, well, thank you so much for joining us this morning with all that information. Hard to believe 150,000 people diagnosed each year. Well, another fact, just to know, go and get screened. And stay with us. Alex is in next with another forecast update.